We now have Dr. Robert Reiss, a very renowned dentist, and we're happy to have him. Thank you.
Good morning, good afternoon, good evening. It's been a great weekend. I really appreciate being invited to be here. It's my second time, and so many wonderful things have been said by the previous speakers, and so many of the things that they spoke about were things that were on my mind. You really did it. When you talk about women's health, not only in dentistry, just generally, you're talking about genetics, diet, exercise, and stress. And I think that's all been dealt with, but I think that the most important thing in our society is stress on women. And I think the biggest differential in my practice is that women face many more stresses than men do. And it's true, you can't control genetics, you can't control diet and exercise. But in our society, what I see is there is so much mental and physical stress on women that they're really multitasking, being parents, running businesses, handling their husbands, putting up with physical and mental abuse from the people they're living with. And I see the effects daily in my practice in the diseases or the symptoms that women present with. And there is a tremendous discrepancy in the incidence in women and men. I don't see many men coming in with temporomandibular dysfunction, pains in the neck, pains in the muscles of the face, clenching, grinding, almost anything you want to talk about. Women, in my observation, are much more predisposed to these conditions. And my feeling is that in our society right now, women are still being treated with prejudice and as a minority that doesn't have to be reckoned with. And even in Congress today, they're attempting to take away the rights of women to contraception and to determining how their lives are going to be lived. And it just boggles my mind that in 2012, we're going back to Roe Wade and everything else. And I think that the people that are proposing this must be out of their minds. But, so just to go on and not take too long, because I know we're long overdue, the things I see are the effects of women during pregnancy on their dental health. And what we see is that in pregnancy, the bone in the mouth and other parts of the body act as reservoirs for calcium and other minerals that the baby is lacking or needing. And as a consequence, we do see basically softening of the bone, mobility of the teeth, increased caries, and consequently dental disease that has to be treated. And this is something men don't have to deal with. Diabetes, obesity, all of these things have an impact on what's going on in the mouth. Diabetics obviously have slower healing times, and they just don't respond in the same way to anything you do dentally. When women are on birth control pills, I just have to assume that birth control pills are hormonal treatments, and they do alter what's going on in the mouth. And we do see red, swollen tissues which mimic what's going on in pregnancy. And I feel that, I was just saying to Reza before, that it seems to me that we do all these things, medications are taken with very little regard to the side effects. I know birth controls are standard, but as he was saying, there are very many other ways of dealing with it without running the risk of hormonal supplementation. Many women, and I think this is true with men too, our society has become drug-oriented. I don't mean illegal drugs, I mean legal drugs. And that these drugs that are being marketed to people on television and in print media, people are being told to ask your physician if this would be good for me. And a consequence is that maybe 85 to 90% of the drugs that are being marketed cause dry mouth. And dry mouth is a painful condition where people bite themselves and where they can't chew properly. And most of our drugs, and I'm sure most of us weren't born Lipitor deficient or all these other drugs deficient, but we're just a drug culture. And the side effects are enormous. And we see it in dentistry. And other people trying to alleviate the dryness will suck on Tic Tacs and other candies, and as a result of keeping this in their mouths for hours on end, they end up with rampant decay. Another issue for dryness is stress. And when people are under stress, it's the fight syndrome that we were talking about before. And as a consequence, salivation dries up. And if you're under stress for a good part of the day, you're going to end up with extreme dental disease, leading to clenching, bruxing, and this is what we see mainly in women. Stress in women, I think, in our society has many facets to it. Many women are in relationships where the partner they're living with is either mentally or physically abusive, there are children present, and there's really no way out. And as a consequence, I see women developing neck, muscle pain in the mouth, pains in chewing, complete temporomandibular dysfunction. And there's nothing I can do to alleviate that. We can make bite plates, we can give them advice, but essentially their lifestyle is what's producing the stress in their lives. And stress has many effects besides what I see. I've recently been aware that stress tends to undermine the immune system. And if a person is living under stress constantly, we're going to see a diminished ability to fight disease, and we may even begin to see allergic reactions based on no allergy to drugs or foods or anything, just based on stress, with an outbreak of hives. So this is basically due to a diminished immune response on the basis of stress. Another situation we have is where we have osteopenia or osteoporosis, and we see people taking bisphosphonates in order to alleviate this. And this is what we were just discussing before. I think that instead of being medicated with bisphosphonates, we're better off preventing it by proper diet and consultation with physicians. I have many patients that have been on bisphosphonates, and some of them who've been infused with it tend to develop necrosis of the jawbone. And if you're taking it orally, it isn't as much of a threat. But some people react very badly to bisphosphonates, and they may develop reflux, and then they're given something to treat the reflux, and then the drug given to treat the reflux causes another side effect, and it's just pyramiding. So I think that one of the things we have to do is to start minimizing how many medications we're taking. I have patients coming in that are taking 12 to 14 medications a day, and while each medication was given by one physician for one condition, there's never a consultation with other physicians that are giving them other medications, and I'm sure the FDA has never tested 10 medications effect on 10 other medications. So that's another big problem. What happens with the FDA with regulation and marketing? So I think that's about that's all I'm going to present, because I think we've gone way over time. And I just want to thank you for your attention, and I want to thank all the presenters, because you really taught me things. And I will ask for directions. There was a joke like that when the Jews were wandering the desert for 40 years, and their wives said, we wouldn't be doing this if Moses had asked for directions. Thank you.
We have been, I have known Dr. Reiss, how many years?
Too many.
A long time, over 40 years. Thank you for your presentation.